Everyone, Dr. Luke Peterson here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about ways to improve your sleeping after knee replacement surgery. Everyone, hope you're having a good day today. So in this video, we're going to talk about sleeping. Obviously a very common issue, common concern after knee replacement surgery is difficulty getting to sleep, difficulty falling asleep, finding comfortable positions for sleeping, and all of the above. So the first thing I want to say when it comes to sleeping after knee replacement surgery is, one, you want to have a mindset of acceptance. Accept that it's most likely going to be difficult to fall asleep, to stay asleep after surgery. What happens sometimes is we get very frustrated with our difficulty sleeping and our inability to sleep, and all this leads to is a compounding and a catalyst that increases and grows the problem worse and worse. We get more anxious, we get more upset, and then we have more and more difficulty falling asleep and getting the sleep and rest that you need. So the first thing I want to say off the bat is you need to have a mindset of accepting that even with my best efforts and everything that I do, it's very likely that I'm going to have some difficulty sleeping after knee replacement surgery. And I'm just going to accept that that's the nature of the situation and that it will get better, hopefully, over time. Now, that being said, here are some tips to hopefully improve your ability to get to sleep and stay asleep. So one thing is you want to practice just universal good sleep tips. So practice the things that any person can use to help maximize and improve the quality of your sleep. So that's things like having a dark environment and avoiding any light in your bedroom or where you're sleeping, having a very quiet environment or maybe just some white noise. It includes having a good room temperature, so being in that 65 to 68 degree range is really found to be that ideal temperature. A little bit cool is that ideal temperature for getting to sleep. You want to have a good sleep schedule, so trying to go to sleep at around the same time and waking up at the same time every day. Work on that, improving your rhythms of sleeping, getting up and going to bed around the same time, and that's going to help you fall asleep more naturally. Your body's going to become accustomed to that cycle. Of course, you want to avoid screens, so avoid the blue light an hour, half an hour before going to bed. Again, due to that circadian rhythm, that melatonin, trying to avoid blue lights prior to bed. Keep the phones, keep the TVs, computer screens out of the bedroom if you can. And then just trying to limit caffeine, especially in the afternoon and evenings. Limit alcohol intake to maybe a couple of glasses as well. So those are just kind of the universal tips to improve and maximize sleep that anybody can use. Now, in relation to your knee and your knee replacement, one thing that can be very helpful is doing some techniques and utilizing some strategies within probably an hour to half an hour before going to bed that are going to decrease pain, decrease symptoms, decrease swelling, at least enough that you're able to be comfortable and get to sleep. And then once you fall asleep, that gives you a better shot of staying asleep longer. So what I like to say is if it's using heat, if it's using ice, if it's doing some gentle stretches or range of motion exercises, if it's doing some self-massage, maybe with a stick, maybe with a lacrosse ball or foam roller, utilize one of these techniques or a combination of these techniques. Start to calm things down, decrease that sensation of pain and tension and stiffness in the leg prior to going to sleep. Also, if you're taking pain medicine, it's good to kind of time that so you're taking it prior to going to bed so that you're having the effects of the pain medicine as you're trying to go to sleep. And all this together is going to decrease that pain and hopefully give you enough comfort that you can fall asleep a little bit easier. Some other things to keep in mind is positioning. So we'll do a video all about positioning, utilizing pillows, wedges, things like that to get in a comfortable position to fall asleep and stay asleep. But it's all about using pillows, guess and check. That's the gist of positioning. And then you also just want to try to stay away from things like sleeping pills, sleeping medication. It tends to sedate you more than it helps you to fall asleep. So of course, when you go to sleep, your brain is still working and active. There's different brain waves. You have your stages of sleep, you have your deep sleep, you have your REM sleep, and there's very many processes and things that are going on in your brain and your body as you sleep. And if you're taking a sleeping pill, sleeping medication, really all it does is sedate you. So it's like you're asleep, but you're not getting the benefits of the brain waves and the healing and the rest throughout your body that is normal and typical. So I like to say stay away from those if at all possible. All right. So those are my top tips. Again, the number one thing is just go with a mindset of acceptance that, you're going to have some difficulty right now. It's not the end of the world. It gets better. It gets more comfortable slowly over time. It may take a while, but it typically and usually does for the majority of individuals. So keep that in mind with all of this, and best of luck to you. Thank you.